Yes, I can get started. So thank you guys for showing up to our NMatch 2025 PD panel on Wednesday this evening. We're going to start off just by introducing the three of us who are on the NMatch leadership team. My name is Shayna Anderson. I'm a fourth-year medical student at Wright State University Boonshoff School of Medicine in Dayton, Ohio.
I'm Daniel Lee. I'm a fourth-year med student at Michigan State University College of Osteopathic Medicine.
I'm Cheyenne Lockwood. I'm a fourth year at the Idaho College of Osteopathic Medicine in Boise, Idaho.
And then I'll introduce our amazing panelists who took the time out of their evening to join us this evening. So we have Dr. Alan Wang from University of Arizona College of Medicine in Phoenix, Dr. Pearce Korb from Virginia Commonwealth University, Dr. Jeffrey Ratliff from Thomas Jefferson University, Dr. Ligia Onofrei from University of Utah, and Dr. David Avila from Geisinger Health System in Danville, Pennsylvania. So this evening, each panelist will have 8 minutes to speak, during which they can talk about their program or what they look for in an applicant. We'll cut you off at the 8-minute mark to ensure that we have enough time for the Q&A at the end. Attendees, you can provide questions for the Q&A throughout the entire Zoom presentation with our Q&A feature, and you can choose to be anonymous with your questions. We'll keep track of all the questions and ask them at the end. If you have a question for a specific panelist, be sure to state which panelist it's for so we can ask them. And yeah, thanks for coming.
All right. So first up, we're going to have Dr. Alan Wang from the University of Arizona College of Medicine, Phoenix. Thank you, Dr. Wang.
Hi, good evening, everyone. It's good to be here. It's actually my first time doing this, and I've seen it before, so I was pretty honored to be able to speak here. Quick intro to myself. I am a Phoenix native, born and raised. I did medical school here at University of Arizona College of Medicine, Phoenix. I was actually part of the second class ever for a pretty new med school. I did residency at Jefferson University, where Dr. Ratliff, he joined my PGY 4 years, so we only briefly crossed paths, but now he's become a good friend and a good colleague. So yeah, I can move on to did you guys get my slides? The next one? Okay, perfect. Yeah. The next one after this. There's a lot of the stuff you guys can look up online, so I figured I would just give you some fast facts. I came here to this program in 2018, and we had only been a residency program for about 2 years before that. We've grown tremendously since then, and now previously were an advanced program and now became a categorical program. Couple of new things that have happened in the last couple of years. We now have 4 residency a year. Previously, we were only 3. So now totaling, we will be able to have up to 16 residents total, which is awesome for us. We had a neuro ICU, like a dedicated neuro ICU, but now we have neuro ICU faculty. So applicants know that was one of the things that we have been striving to try to improve on, and to be able to recruit multiple neuro ICU faculty is huge for us. And being a new program, it's hard to get fellowships. But now, in addition to sleep, we now have a stroke fellowship. And we've also expanded our curriculum to include 5 weeks of vacation for our residents. So kind of copied what Dr. Ratliff did at Jefferson, where we had 4 weeks of vacation for residents, and we added on a 5th week, sort of during the midwinter holiday season, where half the residents are off for a week, and then the other half of the residents are working, and then vice versa. Our faculty size is growing. We're only at 10 full-time. We have a lot of part-time faculty and community faculty, and we also have faculty at the Phoenix VA hospital. The residents rotate at 2, but 10 full-time dedicated that are here, and we're about to get 1 or 2 more in the next few months. Our residents, they average around 29 years old, so run of the mill, nothing too young, nothing too old. And we're a pretty diverse group. Our residents come from all across the country. They are fantastic and hilarious to be around. That is our Instagram that I do not run. It is run by one of our PGY2s, and they're very happy and proud to run it. So next slide, please. I don't have a lot of sage advice. The biggest thing I always tell people when they ask is really just to be yourself. Since we've transitioned over to virtual interviews, you don't really get to be here to see everything. And so there are some things that, you can take cues from in person that you may not get. And so as much as, the interview process is us getting to know you, it's also you getting to know us, and finding the best fit only comes when you're truly yourself, to know what you want. That way we can tell you what we're looking for. Our program in particular, we are relatively new and we are growing. We're definitely a program that tends to train a little bit more by volume, where you see a lot of patients and you see a lot of repetitive things that you eventually become accustomed to it. And so, if you're big into research, we're certainly not a program I would not say we're the strongest at that, but it's definitely something that, being yourself will be important, so that if you are truly into research, let us know. That way we can guide you. And I never, shy away from telling applicants, places that they should look at, places they should go to truly get what they want out of residence. My second point is just pay attention to the residents that you see, that you are going to get a chance to meet our residents at a noon, sort of a noontime session where you sit down, they're having lunch and chatting with you, and just pick their brain. You see what they think about the program, but also pay attention to their body language and how happy they may seem. Sometimes it can go a long way. And then finally, if you're at AAM, come say hi. There's always that session in the evening for residents and students that to get to know the programs. Always say hi. I think last year I got put in a corner. I don't know why, but I meant it. I think I was next to Jeff, so I didn't feel too bad about being put in a corner. So, but yeah, come say hi. I'd love to chat, to get to know you a little bit better. And that's pretty much all I got.
Thank you, Dr. Wang. All right, up next we have Dr. Pearce Korb. He is at Virginia Commonwealth University. Welcome, Dr. Korb.
Yeah, no, thank you for having me. I don't have slides because I knew that, listen, I'll take any chance to talk about VCU, but I figured for this panel, you mostly kind of want to hear about what we'd have to say as program directors in this process that you're in. I like the idea of seeing where we come from. I went to Emory for medical school. And I just so you know, I didn't know what I wanted to do. I dual applied to both neurology and internal medicine because I was between the two fields around this time, and then had a fourth year elective in neurology that sort of sealed the deal for me. So I sort of pivoted late straight into neurology, and ended up being an epileptologist and an educator. And I tend to think of myself as an educator before I think of myself as an epileptologist. I think the good news is what I tell when I advise third and fourth year medical students at our home institution. The good news is it's hard to find a bad neurology training program. And that's the really good news. The hidden secret. I mean, I'm supposed to hear promoting VCU to some extent, but I think what the good news is you see all these devoted educators here tonight in front of you. They represent one of very many great programs in the country. And what you really want to be looking for is what I kind of think of it as a triad of the ultimate authentic clinical training and education. We can all talk about our cool lecture programs that we put on, novel formats, board reviews, wellness programs and initiatives, which we'll probably talk about at some point tonight. But ultimately, what you want is a diversity of clinical experiences that's you in front of a patient, and hopefully at some point, a quote unquote expert. And an expert can come from many different places at many different times, but you want to really enhance that moment in time as many times as you can. And what's really kind of a short program, I know that's kind of hard to think about, given that it feels like a long program, but it's not a lot of time to have a lot of authentic learning crammed in. And so, I encourage you to look for programs that offer diversity of clinical experiences, diversity of clinical settings, both outpatient and inpatient. What you'll find is that geography matters quite a bit in terms of what your preferences are. When you have a selection of really, really great programs, VCU, if I could talk about VCU, we're a pretty large program. We're 8 residents per year. One of the unique features of our program is that we're an advanced program, and that might be worth mentioning to this group as you look at, for the first time. For us, it's old hat because we have students come through every year, but the first time and only time you do it, hopefully, you're like, what is an A program and what is a C program? What I'm referring to is an advanced program versus categorical. In short, An advanced program offers you a spot in the PGY 2, 3, and 4 years of neurology, but the internship is some level of separate. Now, we're fortunate that our relationship with internal medicine at VCU is locked and loaded, meaning that if you match with us as an A program, you automatically get slotted in our first year preliminary internship. But there are some programs in the country that are true, what I call isolated A's, isolated advanced programs where the intern year is not totally locked in, but that's a pretty rare program these days, just so you know. So if you see that, just, ask questions of the program coordinators or program directors about that, or ask your mentors about that particular issue. But yeah, we're, just stats wise, in fact, again, I'm not here to necessarily just promote VCU, but reputation obviously can matter, but not always. And I always say that because I tend to think about VCU. I've only been there for 3 years, so I still feel pretty new. We have 60 full-time clinical faculty. We have 24 residents that don't include the interns. We have 9 fellowships out of 11 different clinical departments, including kind of exotic ones like neuro-eye and neuro-oncology. And so I only say that not as a yay VCU, but there's a lot of programs like that. So, don't just go by, News and World Report rankings. Make sure you check out the programs. Ask your colleagues, ask your mentors in your departments where they went, who they know, what programs they like. We kind of have sleeper picks that we like quite a bit, if I can use, fantasy football draft parlance a little bit. And then as far as what do we look for at VCU is probably pretty similar to most places. I tend to say that we don't have a lot of criteria, and on purpose. Because if you truly want to be inclusive and diverse in your recruitment, if the more kind of bullet points you have, the more criteria you have, informal or formal, the more exclusive you get. So we always say we want intellectually curious people who genuinely want to learn while they're here, and then people who are truly compassionate about their communities. We do have a curriculum on sort of community service and how to become more engaged in your community. So if we have one brand that makes us probably not unique because other programs do this sort of thing, but one thing that we think distinguishes us is sort of our focus on compassionate and community-based care. That was a lot really fast. I'll cede my time if there's any left.
Thank you, Dr. Korb. All right, next up we have Dr. Jeffrey Ratliff, who is at Thomas Jefferson University.
Hi, everyone, and thank you to our NMatch team for inviting me to participate. Like Alan, this is my first time doing this as well, but I'm excited to be here. In line with what others have said, a little about me, my training has been a little bit all over the place. I am from the Philadelphia area originally, but I did my medical school up at University of Rochester in Western New York, and then was in Central Virginia, just a couple miles away from where Pearce is now at University of Virginia for my neurology residency. And then I'm a movement disorder specialist and did my movement training at Mount Sinai Beth Israel in Manhattan. And I've been at Jefferson since August of 2016. So this is my first and only job. But as you can see here with this title slide, here's just our title slide, including myself. I have 2 fantastic associate program directors, Erica Wang and Chris Skidmore is one of our APDs, who also happens to be my predecessor as program director as well. And then we have 2 fantastic coordinators on our team who really serve to keep things going. So we'll go to the next slide if we can. And then we can, yep. And so really, when I think about our program, I think of sort of trying to keep us sort of grounded in sort of a mission and a vision. I think our mission really is focused on helping everyone sort of optimize their professional growth. And we really found that in rigorous clinical training, and residency is hard. And then I will tell you that, and there is a challenge that comes with residency programs. And with residency training, I think it's important to sort of think about what's the best way to teach in that clinical environment. And I also think it's very important that you need to have a supportive community. Having challenge without support is a recipe for a disaster. So we're going to push residents to work hard and sometimes feel a little uncomfortable. But at the same time, I think our residents will tell you that they feel that they're supported both academically. If they're not sure what to do, they know who they can reach out to. And I think they're also feeling supported by their peers, by their faculty, when they're having just, times when maybe stress is a little bit higher. And I think really what we really want to do is find a way within that environment to get every resident to their full potential. So we can go to the next slide. I will touch on a little bit of the facts and figures about the program. So we are a categorical program. We are 10 residents per class, and we are a larger department. So we have over 100 clinical faculty in our department. And within Jefferson, there's multiple centers of clinical excellence. We're really able to offer kind of the full breadth of neurology and the subspecialties available. We have a dedicated neuroscience hospital as part of our main hospital complex. And that really is a hospital that's dedicated to both research space as well as clinical space. And one of the unique things about Jefferson is there's an integrated neuroscience institute. I don't want to get too much into the weeds, but effectively the departments of neurology, neurosurgery, psychiatry, and neuroscience, a non-clinical division, are all housed under this main institute. And really what Jefferson wants to do with that is really facilitate collaboration across departments, and sort of have these multi-departmental sort of teams. For example, I'm part of a comprehensive movement disorder center that has neurosurgeons, neuroscientists, neurologists, all part of that comprehensive center. Like many programs, I think Pearce's messaging is spot on, that there's going to be a ton of overlap and similar ways that programs do things. We really want to make sure that our residents are trying to get access to that breadth of neurology early on in their training. I think leaders in residency programs and at the academy have done a great job of pushing that fellowship application timeline backwards, but I still think it's important for us as programs to make sure that trainees and residents are really having as much of an opportunity to see the breadth of neurology before those application timelines start to sort of loom, so that they can feel confident in making those decisions. And so you can see sort of our breakdown of outpatient months compared to inpatient months, really trying to make sure that we're not overly front-loaded such that residents don't get some of those outpatient specialties before sort of that midpoint of their PGY 3-year. We can take a look at the next slide. We have a mixture of fellows who go into clinical practice. I will say the majority of our fellows do go into a post-residency fellowship. And so over the past 5 years, you can see some of the sampling of what our residency graduates have gone on to do. We're really proud of the breadth of subspecialties that our residents have gone on to do. And I think you'll see on this list, there's a really good mixture of hospital-based subspecialties, outpatient-based subspecialties. We tend to probably, I would say on a given year, it's probably about half and half in terms of residents that choose to stay and residents that find opportunities for fellowship training elsewhere, which I think is great. And I want our residents really to be able to find the best opportunity for them. With the exception of headache, obviously, everyone who wants to do headache just tends to stay. And I will say that our headache center is kind of a unique aspect of Jefferson's department, in that we have really a very large dedicated headache center of about 11 headache trained faculty. And everyone does tend to choose to stay for headache training. We can go on to the next slide. When it comes to academic and scholarly pursuits, I wanted to touch on both research as well as training as educators. And so on that left panel, all of our PGY4s do give a presentation of a capstone research project. What we try to do, again, we have that expectation, but we want to make sure that everyone feels supported and mentored in that process. And so every resident is paired with I'll say a more research inclined member of our faculty to help work through project design, sort of methodology of their research project. Even if they don't share the same specialty of the project, they can help work through things. We also have experts in medical education research, as well as patient quality and safety research. So if you do have a project that aligns with one of those sort of unique areas of scholarship, we can pair you with a mentor there. We do have funding available for residents to go and present their work at national meetings. And we have an annual research prize, a monetary prize, that our sort of winning project of the PGY4 presentations does get awarded. On the medical education and teaching side, we have a very large medical school. Jefferson's med school classes are about 270 students per class. So it's a very large medical school, lots of opportunities to engage with those students, to teach them, whether they're on their clerkship, whether in their preclinical years. And we do have dedicated electives where we will help residents sort of build their own educational materials, and then we'll directly observe them, give them feedback on their development as educators. And we're happy to also help sponsor and mentor residents who really have an interest in education leadership, whether it's being a program director or a clerkship director, someone who really wants to get into sort of the education administration side of things. We're happy to sort of mentor them and do what we can to help sponsor and facilitate those careers as well. So next slide, please. I think, you know, I mentioned sort of that sense of support. I think that's really the foundation, and the community of a residency program is the foundation upon which a wellness philosophy is built. But that said, I do think it's important to
Sorry,
just point
Dr.
out,
Ratliff,
I'm at
your
time.
last sentence, please. Yes, last
All
sentence.
right. So this is just a little bit of overview of some of our community building that we have in the program. And then the last slide, I just will plug that we have if we go to the last slide. And this is our open house. And so just take a note. We've put that on our Instagram and Twitter. So feel free to sign up and join us and learn more there. So sorry for running up on time. Thanks, everybody.
Thank you, Dr. Ratliff. All right, up next, we're going to have Dr. Ligia Onofrei from the University of Utah. Welcome, Dr. Onofrei.
Thank you. I'm so sorry, everybody. I have a COVID voice, so it sounds very bad right now. But other than that, I'm actually okay. So I just went more along the line of advice. So I'm just going to go straight into my slides, if you don't mind. So I started at the University of Colorado, and then I went to University of Utah for residency, and then I stayed, and I've been there since. So in order for me to start applying for residency, I really had to start with my why. And I really want you to do the same. So I really want you to be honest with what you want. You know, there's a lot of different factors that go into your choice, whether that's academics, mentorships, family support, a specific career path, if you want to have access to specific electives or rotations, and a mixture of inpatient and outpatient. That's very important. The size of the program is also very important, or a specific geographic and region or area. But really, one of the most important things is culture. So the culture of the program can be really, really important in picking and sifting through all of these other factors. The things that I caution students against is don't center your residency around one subspecialty. Most of us who go into a particular residency change our minds. I'm a neuromuscular specialist, and I famously said my first day of residency that neuromuscular was boring because I didn't really know what it was about. And I'm a very happy neuromuscular specialist now. But I really had the opportunity to fall in love with that specialty during residency. The other thing that I caution residents to think about is location, like just location, or like the prestige of the university or the program, because if a university is very prestigious, it does not necessarily mean that you have the culture that will be supportive for you. Next slide, please. The other things that I tell the students is to always ask questions. You have a lot of resources around you. So, you know, the attendings that you work with, we've all gone to different medical schools and different residency programs. The residents that you interact with, your other fellow medical students that you meet on the residency trail interview. Obviously, it's a little bit different now because it's virtual, but you have other forums. You can connect with other people from other universities, and you can ask them very direct questions about the culture of the programs that they're in. And they're a really, really valuable source of information. So don't be afraid to ask questions for these people. Next question. I'm sorry, next slide. The other thing I tell applicants is to not over apply or over interview, but also don't under apply or under interview. It's really important to understand like what the numbers are, like how many interviews you actually need to match. And for interviews, about 10 to neurology, for about 10 to 11 interviews is enough to match for most applicants. One of the reasons why it's important not to over interview is because interview burnout is real. And if you're like on your 15th interview, you're not going to have the same level of excitement, and it's going to show. Also from an equity perspective, you're just taking up spots that other applicants could use. So it really doesn't serve anybody if you're over interviewing in the end. So I advise you to choose your 10 to 11 spots really well and go from there. Next slide. The other thing that I wanted to mention, and I think is echoed by the other panelists, is that it's really important to have a breadth of subspecialties when you're applying for residency. So it's really good to have more subspecialties and more subspecialists. So if you can, look for places that have more than one person in a specific area just to get a better idea of that particular subspecialty. Next slide. And then make the most of your interview day. The pre-interview dinner is super important, again, to understand the culture of a program. I really feel bad because it's not the same as being in person. I wish you could all come and meet our residents in person, and I'm sure everybody on this panel wishes the same. But pay attention to that, ask questions, get to see how the residents interact with each other, and then don't be afraid to ask the important questions. This interview day is just as much for you as it is for us. So we want to make sure that we're a good fit for you, and we cannot know that unless you ask us what you really want out of the program. So ask everybody. Our program coordinator, for example, is a fantastic resource. She's been around forever. She really knows us very well. Ask the residents, ask the faculty, ask the chairman. All of us are really happy to answer your questions. Next slide. That being said, I think I'm going to echo what Dr. Korb said. All of these programs that you're going to interview are really pretty similar. So you shouldn't obsess over perfect fit. So once you have your list of requirements that you really need to thrive in a program, think about personality fit and culture fit to help narrow down those requirements. But in the end, know that you're probably going to be happy at your top 3 programs. So don't worry too much. Next slide. And last but not least, I was just going to have a little bit of a slide about University of Utah. We are unique in the sense that we have a catchment area of 10% of the landmass of the United States. So we get a lot of interesting cases that are flown to us from all over the West. We have a great variety of rare cases and bread and butter cases. I often joke that if you don't like autoimmune, we're definitely not the program for you because we have a lot of those. We have a lot of mentorship. Amazing residents and faculty, and these are your future coworkers and mentors, so I think they really matter. We have a real focus on education in our program, and we have an excellent track record of supporting our residents in their desired career paths. Our residents have done everything from private practice to fully, academic, research-driven careers. They've gone into every fellowship you could imagine, including autonomics and palliative care and neuro-ophthalmology. And we have a lot of different subspecialties, and I listed them there if you want to take a look at that. And I think that's it. I think I have one more slide. Yeah, so this is a picture taken from our campus towards the Great Salt Lake. In the background, this is my email. So if you have questions, take a picture of this and you can email me. And again, sorry about the voice.
Thank you, Dr. Onofrei. All right, up next, we have Dr. J. David Avila from Geisinger Health System in Danville.
Thank you very much. Thanks for the invitation. Thanks everybody who is here tonight with us. My slides were longer, so those were meant for the audience. So I'm just going to go through the first 2 or 3 here. I'll tell you a little bit about myself, but before I say that, I just want to clarify. If you've looked at our program, there can be confusion. There are 3 Geisinger neurology programs, 2 adult neurology programs, and 1 child neurology program. We are in Danville. There's a new program that just started last year. They started their first class in Wilkes-Barre, if you're familiar with Pennsylvania. We're not the same. 2 different programs. Yes, same institution, but 2 different programs. Last year, there were a bunch of questions about that. Now we're not the same. So we're in Danville, central, rural Pennsylvania. That's a picture of our resident, our not most recent, but retreat, but the retreat last year. If you're outdoorsy, central rural Pennsylvania will be right for you. So you can see that in the picture. Those are our residents. One of our associate program director, Dr. Esch, in the middle in pink. We had a good time doing zip lining and other fun things. So about me, I am an IMG. I'm originally from Ecuador. I went to medical school in Ecuador. I came here for neurology residency in 2010, UPMC in Pittsburgh. So feels like I've been in Pennsylvania for a while. After that, I did clinical neurophysiology, focused on EMG, and followed that with neuromuscular medicine and clinical neuromuscular pathology at Washington University. And then I came back to Pennsylvania, now to Geisinger. It's been my first and only so far attending position. I joined in 2017. I became PD in 2020, May of 2020, 2 months into the pandemic. So that was a lot of fun. But anyways, and it's been great. My wife is also a neurologist. She's now a stroke neurologist. The reason that we came to Geisinger was because she matched here for residency. That's it. I followed her as a good husband. But when I get that question, like, why are you here? I like to tell you a follow-up story, which is what has kept me at Geisinger, is that I have had all the support that I have needed to expand in both my interest in both education and my clinical interest. I do neuromuscular, and I have a few things in neuromuscular that I like, and my chair has always been very supportive with anything that I went to him and asked, hey, I want to do this, and been fully supportive. Education, I was first core faculty and then APD, then PD. So that sort of progression has also really been great for me. So that's the reason I've been here now for 8 years and will probably continue to be for the next 8. So that's me. Next slide, please. All right, so if you want to know one thing about our program, I think that should be our mission. And we all have our missions. You can see them in our websites, in our social media accounts. If you can find it, you can ask us, but we're all supposed to have a mission. ACGME says that we're supposed to have one and share it with you. So this is me sharing with you our mission. And really, it's that first line that I want you to remember. So our mission here at Geisinger is to train excellent future clinical neurologists and clinician educators. So yes, we're all responsible for training clinicians, seeing patients, taking care of patients, but we want you to be an excellent clinician. And you may be thinking of, what does that mean? And we do have an idea of that. We have our aims that we deconstruct that a little bit. But in short, when I'm asked, what do you think of when you think of an excellent clinical neurologist? I think of someone who can do the initial evaluation of any neurologic complaint. We have subspecialists for complex cases, weird cases, atypical presentations of uncommon diseases, refractory cases, sure. But that initial evaluation, that initial workup, that initial differential diagnosis, thinking of common stuff, uncommon stuff, at least recognizing that is what we want our residents to do. Also, residents who practice evidence-based medicine. We have a whole curriculum on evidence-based medicine, oral evaluations. We ask the faculty to comment on evidence-based medicine. Are you practicing evidence-based medicine and following the guidelines for diagnosis, treatment of common and uncommon neurologic disorders, things like that. So those are some of the things that we think about when we're thinking about that excellence level. And the other part, which I think is one of the things that makes us kind of unique. I know we're not the only program. Jeff talked about this, but we want to train educators. We want to train educators for the future. And if you're somehow familiar with the requirements for neurology, there's nothing in the ACGME requirements that say that we need to or should train educators. We do it because we think it's important, because we like to do it, because we think we're good at it. That's me bragging about our program and our residents, but I think we are. I think our outcomes support that. So if that clicks with you, if you think, yep, I want to see patients, I want to be a clinician, either general neurology or subspecialty, I want to teach, I want to work with students, residents, fellows in the future, any of those things click with you, I think that will potentially be a good fit. Alan talked about this for his program. I would echo that. We are not a research-oriented program. We do have a requirement of scholarly activity that we all have, because ACGME says that we should all have some participation in scholarly activity in our program. So residents have to do one project, but residents who have a special interest can do a lot more. And if you look at our website, we have everything that our residents have presented, published since 2017, if I remember correctly. So you can look at that in our website. The pictures that you see there are most recent, well, all the classes that I have graduated as a program director since 2020 until the most recent one. And when I looked at all these pictures, I think that You know, all of our graduates at different levels, they highlight some of the features of our mission. It's excellent clinicians, educators, you know, communication skills, things like that. So that's what I want you to remember about our program. In the next few slides that you have there, you can see our aims, but I want to advance a couple of slides. Next slide. Also some fun facts about our program. Next. That one. All right. So when I get the question of what am I most proud of our program, it's a metric. You know, I think most of us in neurology, we're analytical. We like numbers, metrics, outcomes, things like that. So the one number, if you're going to remember one number about our program, this is the number that I want you to remember. Our retention rate, 53% of our graduates. By the way, we started in 2012, so we're 12 years old, our program. So we're not new, we're not super old. I think we've reached a level of maturity enough to have an idea of what we're doing. But more than half of the residents that we have graduated have returned to us for their first faculty position, and the majority of them are still here as attendings with us. And that is something that it's the metric that I'm most proud of, because I think nobody knows a program better than the residents, the people who train at that program. You go the good, the bad, and ugly. We all have different skill sets. We have things that we do great. We have things that we need to work on and improve. So for our residents to know all of that, to go to a different place, because they have all gone to fellowships at different places. None of them, we're going to have our first one next year, doing a fellowship here at Geisinger. So to see a different environment, different institution, different system, to interview in other places for faculty position, and to decide to come back to the same place where they train, with the potential barrier of I'm going to the same place where I was trained, are they still going to see me as a trainee and they're going to be telling me what to do, or are we going to be like, you know, equal colleague level? I think that says a lot about the program. So that is one metric that I wanted to leave you with. And all of those pictures that you see there are former graduates that have returned to our program, and we're happy to have them now as faculty, not only teaching faculty, but core faculty. In the middle, you see on one side, Dr. Vaninos, core faculty, epilepsy.
Thank you, Dr. Avila. Last sentence, please.
And that's all I have to say. So perfect timing. Thank you very much.
Thank you to all of our wonderful panelists. We will now be moving on to the final section of the panel, which is the Q&A. Like we mentioned before, if there's any specific questions you have for any of our wonderful PDs, please, in your question, address it as, you know, dear so-and-so, and then follow with the question. Otherwise, we'll try and look through the questions that you guys have been asking us, and I'll try my best to try and group them up so we're not repeatedly giving them the same question. And then after I ask the question, panelists, you're more than welcome to kind of jump in whenever you'd feel like to share your opinion. So question number one, what do the panelists think about program communication? For example, letters of interest before and after the application is submitted, or before or after interviews?
Okay, I'll take that one initially. I'll let the other panelists talk about other sides of this. You know, there's probably a right and wrong way to do it. I think that if it's sincere and specific, programs like ours, you know, again, you know, we'll probably look at that and be excited about that. We like to think that we rank people based on their candidacy. By the way, just so you know, the word ranking is gross to me. I don't like it. I get excited about all the candidates, so it's a weird process for me. But having said that, you know, having a genuine interest in the program, I think, is reasonable to express. But I'll let the other panelists say like how not to do it, maybe, if there's such a thing for you all as well.
I mean, I personally think that, you know, it's by all means is not a necessity. I mean, the plenty of residents we end up with have not sent any sort of pre or post interview communication to us, and so it's not something there's like a checklist like, well, you know, they didn't send us an email or didn't send me a card. So I don't really necessarily know if there's a wrong way to do it, Pearce, but I agree with you. You know, if there is a very genuine and specific reason and they're expressing, you know, the applicants expressing their interest to us, I think it does speak a little bit to us. But my main thing is it's not needed. You're still going to be ranked according to your candidacy, you know, how well we think you fit, and not because you did or did not send anything.
Yeah, I agree with that. I just want, and not necessary, but I would echo the comment that especially the after interview communication. So if you guys, there's all these rules with the match, so we're not allowed to ask you your preference. You're not allowed to ask us our preference. So that's it, but it can be offered. So if you proactively do it or we proactively do it, that's acceptable. So if you have an honest interest, sure, you can, if you feel that you really want you know, to be in a program and express that interest, but you know, be honest about it, because we've had in the past people who have said, yeah, you're my number one, and you know, they're ranked to match, and then we don't rank them, so that means that we were not their number one. So that after the match doesn't, it's a professionalism thing. It doesn't make a good impression after the fact. So if you're going to do it, just be honest about it, about the interest.
Moving on to the second question on the subject of academics. So for your programs, do you accept COMLEX only, or do you require USMLE? And do you have any score cutoffs for the Step 2 exam?
I say we actually accept either Step 1 and 2 or COMLEX. We don't have cutoffs, but it is important to make sure that you have, like on the COMLEX exam, we would want to make sure that you have an equivalent step step score that would mean you would have passed the step exam.
Yeah, I'll jump in and say we don't have a numerical cutoff. Everyone needs to have passed step 1 for an interview. That doesn't mean you can't have passed on multiple attempts, and certainly folks with a failed step 1, I realize, you know, lots of folks have various circumstances that might have led to those failed attempts at a step 1. For step 2, we don't have a cutoff. We don't require step 2 for interview consideration. The only thing that I do have is that everyone needs to have passed step 2 by the time it comes to our rank meeting. So I won't put someone on my rank list who has not passed step 2. And that's really honestly just a safeguard that if I put someone on my rank list, I certify it, it gets locked in, and then that applicant were to go on and match with me but fail step 2, I've got a matriculation problem where that candidate would not be able to matriculate to my institution. So I just make sure that everyone has the ability to matriculate to Jefferson by passing step 2 before I put them on my rank list.
But for our program, you don't need both. You can have either COMLEX only, USMLE only. Similarly to others, we require a pass step 2 or COMLEX 2 by the time we rank. We will interview you without step 2 or COMLEX 2, but by the time we create the rank list, we need that. We don't have a cutoff, but we do give preference to no failed attempts in the exam. We have interviewed applicants who have had failed exams. We have matched them. They have graduated. They have been great. As Jeff was saying, we understand that there are different circumstances, and if that is the case, that may be considered an orange flag, red flag, depending on what color you like. I recommend you that you are open about it. You talk about it, your personal statement, which is the opportunity that you have to say whatever you want to say about, or write whatever you want about you.
Yeah, we're the exact same. Agree with all the above.
Short and sweet. All right, so some of you have already touched up on this subject, but how would you advise applicants who believe they have red flags in their application, whether it be a failed attempt on an exam or whatever circumstances or thing that they believe to be a red flag?
I think what Dr. Avila said is important, that I am choosing my words carefully here. I don't think it helps your case if we have to go digging through the application to sort of figure out what were the circumstances around that and or not be able to find it. Like I said, I think the folks in the sort of virtual room here are understanding and realize that circumstances and people make mistakes or people have a slip up that may sort of contribute to one of these red flags. But I think it's important to sort of own it and sort of acknowledge whether it's how have you grown from it, what have you done to sort of, change your attitude towards things, were there circumstances that led to it. But I think use the narrative opportunities you have in your application to address it, I think is sort of the message that I would want to deliver, rather than hope that we don't notice, which I think rarely happens, but I don't think that's going to serve anybody well.
Yeah, I think kind of expanding on this a little bit too. I mean, some of the most powerful narratives and stories I've heard from candidates in the years I've done this are overcoming, troubles. And it's sort of making it anonymous as many years ago, but there was a candidate who had long had a DWI charge and rebuilt their life afterwards. And it was a remarkable story. And it really did genuinely underscore their character. And they've gone on to do great things. And so I think that it really can be something quite powerful. There were questions in the chat also about, and they were anonymously submitted, but, had trouble in the first cycle or changing career paths into neurology. The secret, and maybe actually, I don't know if the other directors will agree with me here, but one of the secrets of what we're looking for is all those fancy words we said: intellectual curiosity, compassionate care, all those things, but also someone who really believes in authentic clinical training, meaning someone who is not going to be in your office every day complaining about the program. Now, every program director here has an open door policy, I'm sure, and fields very valid concerns about their programs over the time and gets a lot of valuable feedback from the residents. But we want somebody who is going to really, put forth an effort to learn as an adult learner. And so, if you have, perhaps your interviews in the last cycle or other times didn't necessarily put that foot forward, make sure you kind of think about that, because that's one thing that we're looking for. Deceit, or hiding something is not a good sign. The most disastrous residence things I've been involved with involve deceit. So don't be deceitful, because that will sort of send up very red flags in the interview process.
All right. We had a lot of questions surrounding the topic about the geographic preference. So a lot of applicants have questions regarding how do I make sure to either, make sure that that I prefer your geographic area, or is it best for me to just put no geographic preference? A lot of questions about how to just go navigating those questions.
I think it's really important to have a geographic preference and signaling, especially for a program like ours, because in the mountain region, we would not know that you're interested if you have no geographic preference. It's very hard to guess. So we would definitely be looking at that.
It's for us out here, Utah, Arizona, it's helpful to know that this is something you're looking for. Especially, given that we're in this sort of virtual ecosystem now, where you can getting the interviews is a lot easier as opposed to in the past when you actually had to fly, get a hotel. There's a little bit more of like not necessarily a buy-in, but you had to go through a lot more. There's a lot more at stake to really make those interviews. So, it helps. Again, we've matched plenty of people in the last 3 cycles that did not have a geographic preference towards the Southwest or to the West region. But if it is something you're truly passionate about and it is something you're really looking for, then yes, geographic preference helps, and it really helps in these sort of more widespread state areas as well. And on that same note, same token, signaling is kind of the same thing. It's just much more, serious. For Dr. Onofrei, out in Salt Lake City, there's, not as many programs to choose from, similar to Phoenix. We got 3 out here. But if you're looking at Boston, Philly, even Virginia too, in Florida, there's a lot of programs in that region. So it's, it can be pretty helpful.
I agree. I wanted to expand on that a little bit, because there's the in the signals, the geographic preference, and there's also the setting preference. So for us, being in central rural Pennsylvania, before we had this, we had to explore this in the application, in the interview. Is this someone who's going to be okay in living in this area for 4 years? It doesn't have to be your dream location, but you're going to be here for 4 years. So I don't want the environment to be the reason that you're going to be miserable every day. So that has been helpful for us. So yes, geographic preference and setting for us. No preference, or if you want a rural setting, that is even better for us. But it's also not a deal breaker. If you're not, then we see in your application that we have common interest, and we will invite you to interview.
And keep in mind too, when you're talking about, there are a couple of questions about signaling. I think last year every applicant got around 3 signals, right? And so for essentially a brand new program like us, when we get a signal, to us it's like, oh, this person really is really interested, because we're so new. We're not the traditional big gun program. So when you're signaling to these particular programs, keeping that in mind also can be helpful.
Thank you for all those wonderful answers. A lot of our attendees are IMGs, and many of them have questions such as, if I'm several years out of medical school, how would my profile be considered? Is it a good or bad thing that I have experience in different fields in my home country? In general, I guess, what is your view on IMGs who may have had prior experiences in different fields?
So, we look, I can only speak for VCU, because I do think there's probably a lot of variance across the country at different programs, but we do take a holistic approach. It's exhausting because we get hundreds and hundreds of applications on day one. And we look at all the information. We don't apply filters differently. That was a question in the chat between international medical graduates and US grads. We don't do that. I mean, again, just so you know, the dashboard of filters is pretty elaborate if you've ever done this, so you've got a lot of different choices, but we try to look at it holistically. As far as experience goes, what I will say for VCU, and this is actually another interesting point, each one of us has a GME office, sort of an institutional governance that we follow as one program of many. And they might have policies about this as well, for which we have to follow in neurology, amongst others. But what we require is meaningful clinical experiences in the last 4 years, whether that be medical school or other participatory healthcare issues, not observerships, not research-based positions in the last 4 years. And the GME office recently expanded that. They had a restrictive clause about it being a US-based experience or a Canadian-based experience. And we got rid of that particular requirement in the last calendar year. And so now it's any meaningful clinical experience in that 4 years. And other places might have similar so we do filter by that. But that's the only filter we have for that.
Thank you, Dr. Korb. Just looking at the time here, we are 5 minutes away from it being 9 o'clock, and I want to be respectful for our program directors' valuable and very busy schedules. So if we did not get to answering your question, please stop by the Friday panel. There will be more program directors there. I'm sure many of them have great sage wisdom to share upon us. So please attend the Friday if you still have questions. Otherwise, follow us on our socials. Follow these wonderful programs on their socials. Look out for their virtual open houses that I'm sure will be coming out. More opportunities to get some time to know these programs and know these wonderful program directors. And lastly, just thank you all so much for, again, taking time out of your schedules, spending time with us applicants. I'm sure all of us really do appreciate all the stuff that you had to share with us today.
Email, can I ask a question? It looks like there's a lot more questions that went unanswered. Will there be a way to answer them somehow? Like I feel bad, I just can't type fast enough.
What we can do is take these questions. We will send them out to the program directors. And on our Twitter page, we will try and post some of these answers on a more like collective basis so that we could try and get that out to some of you guys. How does that sound? Okay, great. All right, thank you again for all attending. Come to the Friday panel if you have more questions. Otherwise, have a wonderful evening.
Bye,
Thank
guys.
you all. Good luck, everybody.
Bye, thank you.
Thank you.